everybody. Brittany over at Integrated Physical Therapy.
Hi guys, I'm Craig. Nice to see you.
So today we're going to be talking about 3 ways that you can improve your knee mobility by giving some hands-on techniques to yourself. So the first one, you can see Craig here has got his foot on a stool. You can use any kind of stool or bench where you can prop your foot up and you can have some room for your knee to kind of be hanging in midair. You might not be as straight as Craig, so if your knee is starting with a little bit of bend here, your goal to get that knee straight is going to be to put your hands on either side of your kneecap. Good, and then you're just going to put some pressure pushing down, not into any kind of pain, but just enough to get that straightening of the knee. So you'll see that Craig kind of plays around. You can play with the position of your foot, either rotating it in, out, keeping it straight up, and just see where you have the most mobility. Your goal here is just to get that leg as straight as possible. All right, so the next thing that we're going to be working on is that knee bending. So if you're lacking some of that, what we call knee flexion, which is bringing your foot closer to your butt, this is going to help improve that mobility. So I'm going to have Craig put his foot up on the stool here. And then one of the motions from the knee bend is also from this lower part of the leg. So as you bend the knee, this rotates inward. And so right now I'm helping out and I'm giving him that rotation myself. But you can also put your hands onto the own lower part of your leg. And as you bend forward, bend the knee more, you're going to pull into a little bit of rotation inwards towards the other leg. Okay, and you're just going to keep repeating that again, just kind of going to the point where you feel it, but not until there's any discomfort. And the goal is to get as much knee bending as you can with this one. And that feels okay?
Feels great.
Okay, and then the last part of knee mobility is from that kneecap. So you want to make sure it should move pretty fluid in all directions so you can see with the leg relaxed like it is here. You have Craig's leg propped up on the table. This quad is relaxed. It's just letting gravity do its thing, and that's what's keeping it straight. And you should be able to move that kneecap in all different directions. So side to side, maybe a little bit down, and then up towards the hip. So if Craig does that to himself, you'll notice that as long as that leg stays relaxed, he's able to get that movement in all directions. If you find a particular area or direction that's stiff, that's where you kind of want to hold and play around a little bit. So for him, if he was having some stiffness on the inferior, so pushing down, he's just going to keep a little bit of pressure, nothing into pain, and just hold it there for about 5 seconds or so, come out of that and do that about 10 times.
It's very important that the quad stays relaxed, because if that quad contracts, the kneecap comes up and you're not going to have movement in there. So making sure that quad and the leg stays nice and relaxed, you can play with just some very gentle, easy mobilization in here.
Awesome.